Well, hello and welcome back. You are here on blackdoctor.org, and today we are presenting to you SOS, Soul Filling Our Sisters, every fourth Saturday here on blackdoctor.org. We're happy to see you. We're glad you came to spend some time with us, and we hope that your soul will truly be filled today because here we are talking about unlocking our health cheat code. We're continuing a conversation that we started last year about Black genes and why they matter. And so today we're going to keep that conversation going. We have an amazing scientist that's going to speak with us. We have a survivor and a thriver who's going to talk with us. And of course, we have Laura Crandon. She's the founder and CEO of Touch for Life, who brings this programming to you every fourth Saturday. And we would be remiss if we did not mention our sponsors. We're so grateful to have them. We're thankful for Logic. We're thankful for high impact partners. And most importantly, we're thankful for you and for your time and that you thought it not robbery to come and spend some time with us today as we talk about unlocking our health cheat code, the Black Genes Matters conversation. Click the share button, tell us where you're watching us from, and let's get into the conversation. Well, it's our first SOS of the year, and we get to start the year off right. I want to bring right now to you Laura Crandon. Laura Crandon is the CEO, the co-founder of Touch for Life. And Laura, welcome. Unmute yourself. I want you to tell us a little bit about why you started Touch for Life, why you started SOS, and tell us what inspired the creation of this podcast.
Yeah, thank you so much, Dr. Mo. It's always a pleasure. Thank you, everyone who's joining us. I started Touch for Life for you, for everyone who is joining us and seeing this, because I realized as a metastatic breast cancer survivor, thriver, that there's so much information our community doesn't know but deserves to know. And so we wanted to make sure we get out into the community and talk to you about everything about health and especially about breast health, which is, of course, near and dear to me. And then we started this series around Black Genes Matter because we realized that so many of us don't get access to testing that really can be life-saving about our risk factors, but also if you have a diagnosis, how that diagnosis can turn out to be a good outcome for you, that having breast cancer or even metastatic breast cancer doesn't have to be an immediate death sentence that we can live. And so, in fact, I was talking to someone earlier today who had questions about their mammography results and what to do. And she came to us because we have answers. Specifically, her doctors weren't recommending any additional screening for her, but we know what's important. And so particularly for us, because we're dying at a 41% higher rate. And so I don't want that to keep happening. And that's why I started SOS, so that every month, every fourth Saturday, you could have access to the experts that are on and that you can get the information that you need. And then we go out into the community and tell the people about important information, guidelines, and things that they can do. So it's all about starting for you and to make sure that we are in the science, we are in the bio data, and that the drugs that come out that can be curative work for us. So those are just some of the things that matter for Touch for Life and for this Black Genes Matter series, because our Black Genes matter. The message really is for us, by us, around our Black genes making a difference.
I love that, Laura, because so much of the way we describe breast cancer, and for those of you watching, I'm Dr. Mo. I'm a breast surgeon in Pennsylvania. I am one of the medical advisors for Touch for Life, and I get to moderate this amazing show every fourth Saturday. But when we talk about breast cancer, there's some mixed things that's happening. And one of the things that's happening is we're seeing that women are living longer with breast cancer. And there's this narrative about how things are getting better. But when we talk about breast cancer for Black women, it's always described in terms of our mortality, in terms of the severity, in terms of the advances, in terms of all the negative things. And I feel like SOS is a great opportunity to present women who are living and thriving and seeking knowledge and empowering their community. It always just feels so uplifting and empowering to me. And I hope that that's what other people get too. And is that something that was important for you to say and to see and to show?
It's so important. What came to me yesterday is that we are the answer to cancer. And I say that because when you think about our biodiversity being Black women and the origin of man, that if we solve breast cancer for us, I think we've solved it for everyone. I think about even my own story, and you think about the genetic history in my family. My maternal maiden name, don't check my password now, but is Chin. My grandmother's last name was Chin.
Wow.
Look at me. I have
Wow.
a really good friend, sister friend, and she found out she's a 2-time survivor, triple negative breast cancer. She found out that her grandfather is Ashkenazi Jewish. Like these are, and she looks kind of like me. Like there's some surprising things, but if we, because we've got so much in our DNA, so much in our genes, we are the answer. So it's so important that our bio data, our tissue, our blood, etc., is in the mix so that when scientists go to study these diseases to figure out what's causing them, why are we getting these diseases? Why are we getting a certain type of disease? That our story is present and represented. And that's why we're here. It's really important. And also to give you access to have the conversation with these experts, to ask your questions and things like that, and make sure that there's an opportunity for you to get the access that you deserve and get the answers to the questions.
Wow. So I heard you say a lot of things, but the one thing I want you all to think about is I want you to think about this, the answer to cancer, right? If we are the answer to cancer, then the answer to cancer lies in our genes. And we're going to talk about that next and what that means and what research is happening. So stay with us. This is SOS on blackdoctor.org. Well, if you're just joining us, this is SOS Soul Filling Our Sisters. We're filling cups today, and we're not only filling cups, we're sprinkling some Black girl magic on top of it. I'm Dr. Mo, I'm your moderator for today, and I get the privilege of introducing to you some true Black girl magic. Dr. Brittany Jenkins Lord, we're going to invite her to the panel. Dr. Jenkins Lord is a tenured track assistant professor in the Department of Biochemistry and Molecular Biology in the Johns Hopkins Bloomberg School of Public Health. Her research interests include understanding the molecular consequences of breast cancer disparities and the contribution of genetic ancestry to disease risk. Did y'all catch that? Your genetic ancestry. How does it impact your disease? In addition to investigating epidemiologic risk factors for breast cancer in diverse populations. And she's going to tell you what that means. Formerly, hello. She was a postdoc fellow in the Cancer Prevention Fellowship at NCI. And I got to read this because these are a lot of abbreviations, but it's basically saying that this sister right here is a big deal and she is the real deal. She completed her PhD in genetics at the University of Georgia, where she investigated the functional role of something called a chemokine receptor in regulating tumor response. So she's not new to this. She's true to this. She's been studying tumors, their response, your response, our genes, and we are so thrilled to welcome her today to SOS, Dr. Brittany Jenkins. Lord, welcome.
Thank you. Thank you. Thank you, Dr. Mo. Thank you, Laura. It's so good to be here. I'm so happy to be in this space, and it's so positive already. And I'm ready to share all of my knowledge with you guys.
Well, let's keep the party going. And let me first say that if you are on social media, you should be following her on X/Twitter at Doc B Jenkins. So go follow her because she is going to give you more information even beyond today. But let's talk about some of your disparities research because one, tell us what that means. And then two, tell us a little bit about, why. First, let's start there. Tell us your why. Why did you do this?
Well, I think researching cancer is so important, especially for Black women. And, it was so important to me all throughout my career that the research that I'm doing has an impact in the Black community. It's the community I'm from, my family's Black. And, I couldn't see myself in any other space but trying to understand how and why this disease impacts our population so much differently than it does many other populations that also experience cancer. So that's what motivates me. That's my passion, and that's what I'll continue doing probably throughout the rest of my career, is hopefully trying to understand this disease better in Black women and how we can intervene and how we can make outcomes better for everyone, but especially for our sisters.
That's incredible. Tell us a little bit more then on the molecular side, because we hear a lot of statistics about breast cancer in Black women. We're 40% more likely to die of our disease. We're more likely to be diagnosed at advanced stages and things. How is the science beginning to help us understand what these numbers mean? And what have you learned?
Yeah, so historically, studies in cancer have been largely based in white populations. And, these studies, if they do look at Black-white differences, they're biologically based. So there's a focus on these biologic differences between race groups. And the problem with these studies is they've kind of stopped there. They've just said there are these biological differences between Black and white people, and that's what causes Black people to have worse outcomes for cancer. But that's an issue because it's not just biology. And it's not just biological differences between the race. So you have to consider the social, the environmental impact, the economic components that are all contributing to cancer outcomes. Collectively, these are kind of known as the social determinants of health. And, we've studied these differences in a certain context. So we've looked at them and how they impact outcomes for cancer. But what I'm really interested in is taking these social determinants of health and I'm linking them directly to tumor biology, to differences just molecularly in our tumors. So while there are genetic differences between Black and white populations, which is what makes us unique as a population, and that's true for any population, I want to better understand the role of genetics, but also how these social and these environmental components and these risk factors can impact breast cancer outcomes and make breast cancer disparities worse for Black women.
That's incredible. So what I'm hearing you say, one is that there may be differences in the genes and what's happening in a tumor, but that some of those differences might be linked to things that happen in society and the experience that we have that contributes to our cancer risk. Is that a fair way to sum it up?
That is absolutely correct. Yeah, there are contributions from our genetics, but also from our environment. And it's really important that we study both of them together because they interact with each other. So it's going to be important that we kind of untie that and look at that from a broader perspective versus just kind of siloing and looking at just the environment or just genetics. We have to look at it all.
Wow. And so let me ask you this. The scientist in me is asking, well, what types of genes are we talking about here? Are we talking about like detoxification genes or other types of, how do you begin to tease this out and put this into categories to even begin to evaluate it?
Yeah, it's not an easy task, and it's not something that we've done well over time. I think people are now just realizing that we're going to have to pull all of this together to really understand the problem of disparities. So, like I said before, each population group on Earth has a very distinct genetic ancestry. It's almost like a genetic footprint. So there are genetic mutations. I tend to not use the word mutations. I like to use the word variants. Mutations can have a negative connotation. So there are genetic variants that are unique to African populations. So only, for example, only Black people will have certain genetic variants. So as geneticists, we can study these small differences between populations, and we can see if they have any impact on how cancer acts in the body of an individual from that population. So, for example, there's a genetic variant that's present in almost 100% of West African populations, and around 70 or 80% of African Americans have this particular variant in this gene. And Dr. Mo mentioned it very quickly. It's a chemokine receptor, and chemokines they work within our immune system. So it impacts how our immune system functions, and in turn, how our bodies are going to fight cancer. So better understanding that genetic marker in Black people and how that functions and how that impacts cancer can be important to understanding the disease in Black people specifically.
Wow.
Mhm.
So if you're just watching us, this is SOS Soul Filling Our Sisters, and we're getting our souls filled today with understanding about epigenetics, right? And I'm going to put that in the chat, put a definition there for us. We're talking about how our gene expression influences our cancer and how the environment influences our genes that influences our cancer. And if you have questions about this, we want to know. We want you to put them in the chat because we got an expert right here, and this is your moment to ask these questions. So, Dr. Brittany, thank you for that. Laura, what do you think about all this? How do you, as a person who's, with a science background ish, how do you untangle all of this? And what questions did you begin to ask that led you to do this show today?
Yeah, ish is right. Good. I'm not a scientist. I'm a computer scientist. That was a long time ago. Um, you know, this is super exciting. Like, finally, someone's studying us. Like, that really long word, maybe we could put that also in the chat. Ketosine receptor. That's exciting. No one's ever really discovered those things about us before, these variants, right? Oftentimes we're tested and the results come back. It's this thing called VUS. And I like to say it's a very unsatisfying result.
I like
The
that.
clinical term for it is a variant of unknown significance. It means there's something there, but there's just not enough information to say what it does and what it means and what to do about it. But this research that Dr. Jenkins Lord is talking about is maybe the key that we were talking about, the answer to cancer, because it's present in our West African roots, present in us because of the Middle Passage and slavery. And maybe this is it. Maybe the vision of Touch for Life, which is that no one dies from this disease, that it's, maybe a chronic condition at best. Like, maybe this is it. Good gosh, I'm so excited about it. And that's why I want to bring this information to us, the community. So,
I love that. And let me ask you, Dr. Jenkins Lord, about this. Does this understanding help us not only in understanding why cancer happened, but does it have implications for treatment and for outcomes as well?
Yeah, it absolutely does. So the better we understand our genetics and how these genetic variants are impacting our disease risk, we can knowledge is power. We can use that data and that information to make more effective treatments. And that kind of goes into precision medicine and just having some very specific treatments just based on your particular tumor. So there are some mutations in tumors that are kind of common across the board. You see a lot of them in cancer, and there aren't many differences between populations, but there are some variants that we just don't understand, and they're again more common in certain populations, and not enough research has been done to really say this variant is associated with a more aggressive breast cancer. So what we need is more participation in clinical trials. We need more participation of Black people specifically in clinical trials, in research,
Yes.
in order to start answering some of these questions. We have to.
Wow. I have a tough question for you here. It's coming directly from the chat. Ashley, thank you for that question. And you mentioned something, Dr. Jenkins Lord, about social determinants of health.
Yep.
And I'm going to ask you to tell us again what that means, but then tell us, how does that impact the stress pathway, and how does that impact our genes, these social determinants of health?
Yeah. So social determinants, it's a broad kind of umbrella term to describe anything kind of outside of our genetics that's potentially impacting our risk for disease. So that includes whether you have a grocery store nearby where you can get healthy foods, and whether you have a place to exercise and be physically active in your neighborhood. I study a lot of neighborhood level factors, but you can also think about like racism and discrimination, like that is going to impact your stress pathways, and that's going to impact your disease risk. So if you are experiencing racism and discrimination a lot, for example, that could really have an impact on how you feel every day, how your body is functioning every day, and how well your body is able to fight disease. So again, we haven't done a great job in the past in linking these social determinants of health with some of the biological pathways that we know influence cancer. So that's what I'm trying to change. I'm trying to do a lot more of that type of research, and there are now other researchers that are picking up on this and doing that type of work as well. But we mentioned the term epigenetics before, and epigenetics, a lot of people think of genetics as something finite, like you get this from your mother and your father, and that's that. Your genes don't change. That's just the way you were born. But with epigenetics, our environments can actually alter how our genes are expressed. And that expression can impact the environment your tumor is in, and how it grows, and if it's more aggressive or if it progresses. So all of these things are linked, and epigenetics is a big field. But I think now we're starting to link epigenetics with disparities and better understanding how our environment impacts our cancer risk.
Wow. So where you live and how you live impacts whether or not you live, right? You mentioned things like food deserts, or we like to say food apartheid these days, things like, the amount of pollution, right?
Mhm.
In the districts where you live, air pollution. And are you saying just the stress of being Black in America can influence your cancer risk?
It sure can.
Ooh, that's
There was a study done in Baltimore not too long ago where they looked at two Baltimore neighborhoods, and they weren't geographically far apart. They were probably maybe, I don't know, 3 miles apart. But the life expectancy in those two neighborhoods was completely different. One was mostly white, the other was mostly Black. And the life expectancy in the white neighborhood was around 86 years old, and the Black neighborhood was about 66 years old. And again, geographically they are miles apart, but just the access to those resources and being economically stable and having these grocery stores available and feeling safe to go outside and walk around, that has such a profound impact on our health. And just that study alone just shows how your environment can really change your health risk. Yeah.
Wow. Wow. So we're talking here, and this is deep. I put a comment in the chat, and we're going to put a banner up that talks about a term called allostatic load, right? It's the technical term for the fact of the cumulative burden, all the chronic stress, the things, the day in, the day out stress that you say, this stress is killing me. Well, guess what? It has an impact, and it has an impact on your body, on your physiology, but also on your genes, and that may impact your cancer risk. And we're so fortunate to have a researcher who is investigating these things. So we're going to talk some more in the next segment, Dr. Jenkins Lord, but I just really want to personally thank you for taking this on, because it helps us to combat the narrative that we are developing cancer because of our lifestyle, our choices, because we're not involved in our health. And I think that narrative needs to be disrupted. And I think you're doing it at the very highest levels. I mean, here you are at Johns Hopkins doing this amazing research. So we just salute you, sis.
Thank you. Thank you so much.
Oh my goodness.
I
Stay
just feel
with
like we should cue the music, Stevie Wonder. Isn't she love?
Well, I don't know if they have that music in the queue, but we're going to hit some music, and we're going to have a giveaway, because that's kind of what we do here. So it's giveaway time. We got a flyer for you. We got a QR code for you, and we have some free stuff for you. So let's put up our QR code and let's talk about this giveaway. You're right, Ashley. This conversation is fire. We want you to click the QR code, pull out your smartphone, and we want you to join Soul Filling Our Sisters community. We got some giveaways for you. So right now, pull out your smartphone, click the QR code, join our conversation. We have it offline. We continue this. We answer your questions, and we are talking about the things that our sisters want to know. We're filling our souls, we're filling our cups, and we're going to keep this conversation going because at this point, I think it's time to talk about not only the genomics, right? What's happening at the gene level, but let's start talking about health equity again. Okay, so join the QR code, click the QR code, join the Touch for Life community. And it is now my privilege to bring on someone who has become a champion, in my humble opinion. Laura, you can weigh in on this too, but we're going to bring our sister on. There she is, Stephanie Walker, right? So, Stephanie Walker, I got to read a little bit of this bio if you're okay with this stuff because it deserves it. You're a dedicated wife. I know how dedicated you are. Your mother, a grandmother, a Mimi, a sister, a friend. She's a registered nurse and she navigates life, bravely navigates it as a metastatic breast cancer thriver. Stephanie was diagnosed in 2015 and she has become passionate about the empowerment that comes from knowledge. Stephanie is the project lead of an innovative initiative called Become, Black Experience in Clinical Trials and Opportunities for Meaningful Engagements. Become. And this was presented as an abstract poster at the American Society of Clinical Oncology in 2022, in December 2022, in San Antonio, at the Black Women Speak Symposium, where she was a key participant, and I'm going to say one of the co-creators of this amazing symposium that I had the opportunity to moderate. It's just been a privilege to get to know you, and you've been involved with Living Beyond Breast Cancer. You've been involved with the Hear My Voice program, the Metastatic Breast Cancer Alliance. You have really, truly committed your life to sharing the journey, to helping us to promote health equity. You are awaiting genetic testing through your participation in a study at UPenn. We're going to ask you about that. And you're going to talk a little bit, Steph, about, what are the issues in health equity and why is this a thing, right? Let's talk about, why it's so important for our community to understand what's happening at the genomic level.
I can tell you it was amazing listening to Dr. Jenkins. Lord, I tell you, I was scribbling real fast and writing notes and words that I hadn't heard before, and it's like, okay, let's look up term. But I am so thankful that she is out there trying to study to fix it, to make it go away, And I think being Black and having metastatic breast cancer, especially for me, being in a rural community, it is detrimental. We're dying like really quick. You're talking about 40%. Man, I'm seeing it. It seems like, one out of two people here that are diagnosed with metastatic breast cancer are dying. And, I arrived on the advocacy scene late, not right when I was diagnosed, 3 years later, when I needed assistance. And to think back then that I wasn't even offered genetic testing. I didn't know anything about genetic testing. I really didn't, and only learned about it, during, the first 3 years because my daughter was pregnant, high risk pregnancy. And her OBGYN said, as soon as you drop it, you're going to get genetic tested. And it's like, "Oh, what? What? And, I'm thankful that he had the forethought to offer that to her, being in her late 30s, and I'm metastatic. And luckily, she came up with, I like Laura's word, the VUS on her genetic testing. So, it was like just put on the shelf and then moved on. At that time, I didn't get genetic tested. I wish I had. Would it have made a difference? I don't know. I can say, my course is truly different than, the next person's. And when I was able to um, get information about the disparities, not just about genetic testing, about treatment plans and everything regarding metastatic breast cancer, to do the Become project was actually to look at the disparities. Why aren't, especially regarding clinical trials, why aren't we being invited into clinical trials? The number was dismal. Less than 6% of all cancers, not just breast cancer, that are the people are Black. They're participating in these clinical trials. And it's like, but why? And there's got to be a reason. And I was blown away by what the reason was. The number one reason was not that we don't know about it or we don't care, is we weren't invited. We weren't invited into the conversation. We weren't told about it. We weren't asked about it. And how are we to know if our primary care physicians or our healthcare providers per se don't talk to us about clinical trials? We're not going to know.
So wait
So
a minute, wait a minute. Let me pause you here. Let me ask you, are you saying, because people are watching from all across the country and really from around the world, and they think that, research is just happening and we're moving along and it's the age of advancement and precision oncology. You're telling me that the number one reason that Black folks aren't in trials is because nobody bothered to ask us?
absolutely, absolutely. That was and I thought it was going to be something complex, but to come back and say that you're not having the conversation with us. And when become that was, I was very determined with the Metastatic Breast Cancer Alliance. When we do the survey, actionable steps had to be taken. Don't just do a survey and let the results sit on a shelf like a lot do. And so that's where Black Women Speak came from, to have that conversation with the healthcare providers, to teach them, if nothing else, how to have the conversation with this. Because I found out on my looking at it is like they don't have that conversation with us because maybe one, being a Black woman. Two, I probably wouldn't understand what a clinical trial is. Three, I probably wouldn't finish it if I started it. And then four, if they pissed me off, I'd become what? That angry Black woman. And I probably would. But it is just not having that conversation with us, discounting who we are. You are discounting who I am before you even say hello. My name is Jack Joe. You don't know
Wow.
who I am, and I'm a nurse by trade. So if I'm not getting that information as a healthcare provider, as a nurse, nobody else is getting it either. So how do
Does it
we
does
act?
it just doesn't make you angry?
It, nah, girl, it pisses me off. To be honest, it just makes me mad. It's like, why not have that conversation with me? I, and not only did I find out that it was a conversation not being had, it's that the majority of us, over 80% of us, would engage or think about engaging in a clinical trial only if you had asked.
Wow. And I'll take it a step further and say that even beyond the asking, there are so many barriers that don't support our participation in clinical trials, that even if you do get asked, even if you do sign up, you might find out you're not eligible because of a condition that you might have, pre-existing
Exactly.
condition. Maybe you didn't take a certain drug, or maybe you did take a certain drug and that made you ineligible. Maybe they don't offer the trial where you live and now you got to travel to get that. There's so many different barriers. And I love the fact that, through the work that you're doing, you're really trying to unravel and tease out some of this through the Become initiative. And so I want to ask you, how do you think that this is changing the face of, how is it addressing disparities in cancer treatment and care? Tell us about some of the good work that Become Project is doing.
We have tried really hard to um, partner with other people to have the conversation with the healthcare provider, teach them how. Maybe I don't know. Other than you can invite me to your med school class and I can teach you how to have a conversation with a Black person.
I'm going to
Invite me
take you up
someday.
on that for this semester at Dartmouth, but go ahead, keep
Call
going.
me, call me. But have that conversation. With us. Um, you know, Starting with clinical trial design, you know, um, offer have something in there to where it's not such a hardship of, especially Black women, not excluding the men, but the Black women that with childcare or meals, missing work. A lot of moms that miss work don't get paid for that day. You know, so and also to have healthcare providers to know who we are, not just what we are when we show up for that 15-minute appointment, but you don't know what I go home to. I could go home to a multi-generational home, and I am the primary caregiver for not only my mom, but my grandmother too, and my kids. So get to know who I am and where I come from. You know, I can dress up and look good and come to your appointment and go home and live in a one room shack. So you need to really know who your patients are. If you're going to be in a community, know who your community people are. Go out into your community and tell them what you're wanting to do or ask them what they need. And when you do that, try to send in somebody that is representative of the community that you are trying to engage.
Ooh, that's tricky though, because here's the thing, like, right, less than 2% of oncologists are Black,
Well,
right?
exactly.
Le-
But why
and-
not an oncology nurse or a
mm,
navigator or a social worker or partner with even having that other person to partner with the community leaders, and then have the community leaders go into their own community. So
mm.
it's not you can't put that back on. We don't have enough Black oncologists. We need to teach everybody,
I love it.
everybody. So
Laura, you about to jump in here. It's like double dutch. I see you. You getting ready to jump into the rope here. Weigh in on this because it's one of the common things that we say in the healthcare community. Well, what are we supposed to do? We don't have staff that looks like this, but there's a solution, isn't there?
Yeah, I mean it's community organizations like Touch for Life, like Touch the Black Breast Cancer Alliance that has navigators. It's really it that's an excuse. I mean, you really could swing a cat and get a person who looks like you as a community health worker, social worker who could have these conversations. And really, it is about asking. One of the things that Touch for Life does is we go around and talk to medical students. We go to doctors symposium and conferences, put a face to the disparity, and challenge them to do better. I tell them their baby is ugly, and I tell them that they have to make the commitment to be more inclusive in clinical trials, applying the standard of care to everybody so we get the right things, and for the testing, genetic and the genomic testing. And
Let
I
me ask
make
you
them
this.
commit because and that's where it is. It's not only the social determinants of health, it's just that the doctor's not doing it.
Mm,
Like what Stephanie's experience is. Two quick stories. One, my son noticed I was taking a medication and he said, "Mom, your hands are black inside." And I thought I was going into organ failure. It turns out the medication said that you may turn red. But also parts of my face was darker. It's hyperpigmentation. But when I looked at the drug side effects, it said you may turn red. But look at me. If I turn red, if Lupita Nawanga turns red, like the world's coming to an end. It just means that no one melanated was in the clinical trial. Second thing is, at one of these conferences, there was this great presentation about this advancement in drugs based on your variant mutation that Jenkins Lord talked about. I was like, great. And you look at who was in the trial, 750 people in the trial. Great. When you break that down by race, guess how many Black women were in this trial for this drug?
you
Two.
telling me too? Wow. So let's go back to basics a little bit here, because I'm going to ask this question again in the next segment as well, because I think this is one of the things that we have to drive home, right? This concept of health literacy before a diagnosis happens. Like, what does our community know even about genetics? Stephanie, I'll ask you this, and like, how do we start addressing this before the level of a clinical trial? What do we understand, and what do we need to know, and where do we go for that information?
It's hard. If you don't know what you don't know coming into the arena, first of all. And I always try to disencourage people to go to Dr. Google, but sometimes that's the only place you can go. Case in point, my case. I didn't know anything about metastatic breast cancer when I was diagnosed, other than it was a terminal disease and that I was going to die in 36 months, period. So, with that being said, I did do a lot of Dr. Googling. And but not enough to find somebody to support me through it. So, it was just me and my friends that were non-cancer friends got through it. But having to get online to find um, organizations like Laura's or Touch the Black Breast Cancer Alliance to have somebody to help you guide you through that. And if you don't have that, take somebody with you to help you understand maybe or write down questions. Always write down your questions, because when you get there in front of the doctor for your 15 minutes, it all goes out of the window. So you really need to have something written down. So looking for somebody to help you get through it. There's many organizations out there that will help people with metastatic breast cancer. You can always call me. I'll go to your appointment with you via phone. I used to do that a lot during COVID, trying to just get someone else that can hear the doctor. And a lot of people don't understand the medical terms, or don't have the medical literacy for it.
Mhm.
So there's organizations out there. You can always call Laura. I'll throw her under the bus right now. To get that information that you need, and always try to remember that a clinical trial is not a last resort.
Mhm.
Fight very hard to be able to get it as part of the standard of care, that it could be offered up in the beginning too, as well. So, I would join the clinical trial at a heartbeat. But, I have been blessed that I still remain on my first line treatment going into year 9. So
Wow.
I, yeah, a unicorn here. So, um, I don't know.
Well,
I
I
just
want
need
to talk more about this. But what I want to do is first things, we've been giving away a lot of things here. We've been dropping a lot of pearls and a lot of knowledge. And I want us to talk a little bit more about the giveaway. I want to put up the QR code really quickly. This is SOS, say Soul Filling Our Sisters on blackdoctor.org. And then we're going to talk about some of these Black Genes Matters resources. But let's throw up that QR code, because when we talk about where do you source good information, right? Touch for Life is an amazing place for you to source that information, so that when you have questions, if you know somebody who's going through a journey, you can get really reliable information and not just have to depend on Dr. Google. So click the QR code, join the community, because we got everything from clinical trials. We talk about hair, we talk about wellness, we talk about nutrition, we talk about everything that fills our cup. And we want your cup to stay perpetually filled here on Soul Filling Our Sisters on blackdoctor.org. So, that being said, Laura, I want you to talk about some of these Black Genes Matters resources really quickly.
Yes, yes, yes. So what we created are resources that really contemplate us, right? In the language that contemplates us. So if you go to Black Genes Matter, blackgenesmatter.info, and click on the resources tab, you can download these free resources. It's got an interactive document of documenting your family history, which is really important. It tells you why that's important. Biomarkers 101, what are these things? Genetics 101, how to get it covered by your insurance. I know that's a big question. We've also got how to have a conversation with your doctor. The question Stephanie mentioned, writing it down. We've got the interactive tool of the questions to ask your doctors, whether you've already been diagnosed or have not been diagnosed and believe you have risk factors, including I talked to someone this morning about the risk factors and asking her, and she was adopted or doesn't know her parentage. That's really important because it's a missing piece of information that your doctor should know. So these are great resources. They have you in mind, made with you in mind. Many are interactive, and then you can download them and take them with you. So wanted to make sure you've got those resources available. What we've also done at Touch for Life is identify clinical champions. So we've got access to an NIH, National Institutes of Health, National Cancer Institute, geneticist, medical oncologist, and resources to answer your questions. I literally sent her an email yesterday saying, hey, we need somebody to get in a high-risk breast center that's really comprehensive. Where should she go? She comes back, Dr. Sheila Rajagopal, with a list. And that's the type of access that Touch for Life wants you to have. And so it's available for you. It's for us, by us, because your Black genes matter, and we want to make sure you've got that information.
Wow. We love Dr. Sheila, and we love that you are joining us here for Soul Filling Our Sisters every fourth Saturday here on blackdoctor.org. I'm Dr. Mo, I'm your moderator, and we got the all-star lineup for you. So if you're just joining us, number one, you need to go back and watch this. Click share on your Facebook pages, on your YouTube, on the Instagram, all the things. But Dr. Brittany Jenkins Lord is joining us. You can follow her on social media at Doc B. Jenkins. We have Stephanie Walker with the Become Project and the NBC Alliance. You can follow her at Faces of Stage 4 on Twitter/X. We got Laura Crandon, Touch for Life. And we got to round out this conversation, right? Because we said a lot of things here today, but let's talk about how people can feel more empowered through genomic information in the context of breast cancer. What are some of the challenges that we need to overcome to make sure that people have access to genomics? And I'm going to start with you, Dr. Jenkins Lord. Talk to us about some of the challenge and the opportunity here.
Yeah, absolutely. So I absolutely love everything Stephanie has discussed. And I think she's absolutely right that we have to empower ourselves by asking questions of our healthcare providers. If they're not going to ask us, we need to ask them. And period. So, we need to be more empowered, asking questions, not be afraid to know more about our genetics and our family genetic history. If you've heard that genetic testing of your tumor can improve your survival chances or your cancer outcome, then ask your doctor if that's a possibility. So it's not something they always offer. And a lot of the times insurance isn't going to pay for genetic testing for your tumors unless there aren't any other treatment options. But it's always good to ask. It's good to ask if there's a clinical trial available. And again, this should be something that's offered right at the beginning. I think genetic testing is the most useful at the beginning, but insurance doesn't pay for it until it's the last resort. So that needs to change. And but as a community and as people of color, we can absolutely empower ourselves through asking questions.
Stephanie, why don't you weigh in here and let's keep this conversation going about how can our communities feel more empowered? Because you mentioned something. You said you're rural, right? We're not a monolith. We don't just live in urban cities and settings, right? So what do we need to do to make sure that this is equitable for everybody?
I think the community cancer centers that we are being, the majority of people are 80% are being treated at. I think they need to be empowered to share this information or have somebody to share that information, because the cancer center that is adjacent to where I live, 5 minutes down the road, they don't have a clinical trial coordinator there. They're, associated with a university-based health system, but then again, it's the trickle down effect. And by the time you get trickled down, there's not much left for us down, at this cancer center. Even me going to an NCI designated center, it's hard to believe that, my oncologist didn't have that conversation with me. I had to bring it up. So, I just I just feel that we have to empower ourselves. And again, I hate that because that actually increases the patient burden to know so much more than they need to going into the fight for their life initially. Just trying to encourage your doctor to ask your doctor the hard questions. Don't go in and just take everything they say for granted. Challenge them. And if they don't like to be challenged, it's time to unfortunately move on. And I feel that way, about your doctors, if they don't have your best interest at heart and not willing to have a discussion with you, the hard discussion is not just oh, your labs are great and you're doing good, kind of a conversation. Um, Maybe that's not the oncologist or the provider for you at that time, but you have to dig around and you have to find. And like we all have said here, Laura's foundation, Touch for Life, you know gives you a ground base education on what you need to ask for, what you need to look for. So you can always start there.
Wow. And Laura, I'm going to start with you. We can do a quick round robin. And I know this isn't one of the questions on our, sort of script, but what are questions that people should ask today, leaving this show? right? Give us something that people should ask their doctor about or that they should know about genetics or genomics, because those are two different but related things. But tell us, like, when people leave and they said, "Oh, I saw this amazing show," and I want to ask you, auntie or mom or doctor, what?
Yeah. Well, one general question is this the best for me? How do you know? Um, and am I a good candidate for genetic testing? Am I a good candidate for genomic testing? And why? Why not? It doesn't have to be confrontational. But you're just asking questions. Would this be a good choice for me? Am I a candidate for clinical trials? And why do you think that, or why not? And opening up the conversation like that are easy ways to just have a conversation.
Doc, what you say?
I absolutely agree. I'm going to go more from the family side because Laura mentioned family health history and knowing your history and your family. And unfortunately, a lot of Black families don't talk about their history. They don't talk about what made grandma sick, or why uncle never spoke, or there are so many things that occur within our families that we're afraid to talk about, and that needs to stop. Our genetics and our risk within our families can really possibly save your life. And just knowing that you have an increased risk early on, because I know a lot of families don't want to tell their children things until they're in their 30s and their 40s and until they're old enough. But if I know at 20 then I have an increased risk for breast cancer, that's getting ahead of the problem. That's
That's
allowing
right.
me to prevent breast cancer versus at 40 having that information and already being at high risk or already having cancer. So, Black women are being diagnosed early and earlier and earlier, and we need to have these conversations with our family, especially if it runs in the family. That needs to happen earlier. So, talk to your mother, talk to your grandmother, anyone, that's the matriarch or patriarch of your family that's going to have that information. We need to be asking those questions.
And Stephanie, close us out on this one. What do we want people to know and take away from this show and this segment and your story?
Oh my gosh. What you take away, one of the first things that Laura and both Dr. Jenkins Lord mentioned is knowing your family history. We have it locked away. I can't tell you how many people that would come into the ER where I was working with advanced stages of cancer that was fulminating from their breast or something, and nobody ever knew. They packed it away, and she played the piano every Sunday at church, and nobody knew. Know your history. Don't be ashamed. Talk about it. You know what I mean? Let everybody know, because it may keep, like I said, I'm doing it for my son and my daughter. So get the information, know the information, be um, knowledgeable about your cancer. Please, Lord, know your subtype going into this. I don't know how many people, like yesterday, I met somebody that had no idea what their subtype was. They told me they just go to the hospital and get their chemo. Well, what are you getting? Well, I don't know. I just sit there and get it. So, please be an active participant in
Mm.
your own care, because 9 times out of 10, the doctor has 50 of you, and he's not going to treat you any different. So you got to make sure you're the different one. You are the one that's going to get the good treatment. You need to be active and ask questions. Always ask questions, and um, be on top of research of what's out there. Genetic testing, get it. If you have progression, get genomic testing on the new tumors if possible, to see if you have, I like that word, a variant as opposed to a mutation. Um, you know, to always be active in your care.
Mm.
Always know you have an option. Always.
Wow. That's a mic drop moment right there. Always, always know that you have options. You've been watching Soul Filling Our Sisters SOS on blackdoctor.org. And if you are just joining us, listen, you got to click share. You need to replay this. You got to share this with some friends and family, because we've been dropping all the pearls here. And we're going to wrap up with a few more right after this. As we get ready to close this out, I have one question for you, Dr. Brittany Jenkins Lord, because there's that saying that we can't be it until we see it, right? And my question for you is, what do you envision for us in our communities? How do you envision all of this information and your research impacting us in our future? What does the future look like for Black women with cancer?
Absolutely. For us as Black women, I think we have to embrace medical testing. We have to embrace the medical community. We have to embrace research and researchers. We have to participate in these research studies. Be advocates for ourselves. Ask for the results back. If you participate in a study and you want to know what the results of that study was, you can ask the researchers. It's something they should be giving back anyway. But that's information that you can learn about yourself, possibly your genetics, just based on what the study was. And on the healthcare side, I really want to see more doctors and researchers collecting information about social determinants that may impact the lives of their patients, their ability to make their appointments, the ability to stick to their treatment regimens. I want research to be more colorful, just like the world is. We are beautiful. All of us are beautiful. And, we all look different, and everyone should be represented in these trials and this research, because how we look and our genetics impacts how we respond to our treatments. So if we don't know that, it's a detriment to us, not them. So
Absolutely. And thank you for that. And Laura, let me ask you really quickly. Talk to us about the specific initiatives and programs, Touch for Life. Where can people go, right, to understand this better?
Yeah, definitely go to touchforlife.org. The resources are at blackgenesmatter.info. And then we have our Behave program. We talked about insurance coverage. We have started a program called Behave, Breast Health Advocacy Voices for Equity, where we're teaching you how to advocate, the legislative process, what does it mean, how to tell your stories. We are looking for storytellers, people who are willing to tell their stories about their experience with genetics and biomarkers. We want to capture that and help influence the legislative process to make these things covered at no cost. It's only covered at no cost by 14 of the 50 United States, and
Wow.
that needs to change. We also are having a Color of Wellness conference. It's coming up on February 29th on the campus of University of Maryland in collaboration with our community partners, Alpha Kappa Alpha, Theta Nu Chapter. It's their 50th anniversary. We have a fantastic moderator who comes from ABC 7 News. We have experts. Dr. Sheila Rajagopal will be there. We'll have other clinical experts so you could ask all the questions. We have folks talking about clinical trials, caregiving, nutrition, fitness. It's really another conference made for you. Please register for it. It is all free. We've also got breast exams brought to you by BEXA. It will be recorded, but we'd love to see your face in the place. We record it and then rebroadcast on blackdoctor.org, but tell your friends and family in the DC, Maryland, and Virginia area. This is worth it. We'll have more prizes, and we have a special partner that will be announced shortly with special memorabilia prizes and giveaways, and it'll be something you don't want to miss.
And there you have it. There is the RSVP. We want you to join us at the event. But I want to take this special moment to thank both our sponsors, Hologic High Impact Partners, thank blackdoctor.org, and thank our guests today here on Soul Filling Our Sisters, Dr. Brittany Jenkins Lord, Stephanie Walker, Laura Crandon, as always, and I am your moderator and your host, Dr. Monique Gary, Dr. Mo. You can follow me on all social media outlets, and we want you and your cup to stay full. Share this information. Join us every fourth Saturday on blackdoctor.org. And we just thank you for watching. Take good care.